Good afternoon, everybody. My name is Samer Aluria. I'm a consultant gastroenterologist, the director of gastroenterology and endoscopy at Medical City Hospital for Military and Security Services in Muscat, Sultanate of Oman. And it's my great pleasure today to welcome a dear good friend of mine, Dr. Thomas Archer, that I had the pleasure to spend a few weeks with during my time in Leeds in the UK. He's an interventional endoscopist who just finished a 2-year fellowship in submucosal and third space endoscopy. And today we're talking about chronicles of a fellow and what that life feels like. So, Tom, thank you so much for joining me. Welcome to this webinar. Can you please tell us a few things about yourself and how you got into this before we start asking you the tough questions?
Yeah, no, thanks, Summer. It's a real privilege to be here to speak to you and share a bit of kind of reflections of, I guess, of my training. If it's useful to other people who are in similar situations, that'd be fantastic. So I've just, as you said, come to the end of my training in gastroenterology and endoscopy. Started in Liverpool a long time ago now, it feels like, doing my undergrad and junior training. UK, I don't know if everyone would be aware necessarily how UK training is based, but you start after your graduate training, you go into general training. So I completed my general training in Liverpool before specialising in gastroenterology. So that was after 5 years undergrad, 5 years general training, and then went to gastroenterology training in Nottingham. Undertook a fellowship, research fellowship in Sheffield, looking into bowel preparation for colonoscopy, completing an MD there. And subsequently, as you said, I've just finished 2 years in Leeds. So it's been a fairly long way to get here, but it's been pretty enjoyable, and now it's nice to had a bit of a pause and reflection before kind of really starting my career as a consultant in gastroenterology and endoscopy.
Very nice, very nice. Yeah, I think it's really beneficial for people to always just take a breather once they're done with their fellowship and just to try to kind of understand what has just happened in the past couple of years. So the idea today, what I wanted to talk to you about, we both have done a fellowship and what I'd like to discuss is like this fellowship journey in therapeutic endoscopy, not just like the technical learning, but the mindset, mentorship, and transition behind it. So if we take like the first the first gastroenterology is such a big specialty. There's so many things that we can do. But we talk about, let's say, the spark. What first drew you towards therapeutic endoscopy, and when did you realize that a structured fellowship was the right path for you?
Yeah. Well, I guess going back, like you said, with gastroenterology, that I think the thing that probably the first spark towards gastroenterology, which you said is in itself is a broad church of different things, but it's more than anything was the team. I think it was the people I worked with. So during my general training, I did 2 jobs in gastroenterology, and I just found I got on best with those people. They're very like-minded, were good fun, made the day interesting, and I enjoyed being part of that team. So that was probably the first thing that really drew me to it. And me as myself, I think I'm quite a people person. I like working with people, which in terms of endoscopy is important because you're never working on your own in endoscopy. You're always in a team. So if you work best with people, that suits endoscopy better, I think. And being able to get the best out of a team is obviously really important. I guess after that, starting gastroenterology, you get introduced to endoscopy, and maybe not for everyone. I think most gastroenterology trainees endoscopy is one of those things you really enjoy. And before you're a gastroenterology trainee, it's mainly an observer sport, isn't it? You're watching, and it's not the most interesting thing to watch, I don't think. But as soon as I got hands-on an endoscope, I realized, this is this is my happy place. This is what I really enjoy. And I guess from there, I basically just took the opportunity to like maximize my experience in endoscopy and really soak up any opportunities I could. I would say
Mm.
was is so it kind of it starts gradually. I mean, I didn't start my gastroenterology training thinking I want to be an ESD endoscopist in 10 years' time. No, but I did know at the start, this is something I really enjoy and get a lot of buzz out of, and I think that's a really key starting point.
Mm. I totally agree with you. I guess in most journeys, I think a lot of people that go into this, they kind of get some sort of exposure either to cases or some maybe an inspiring mentor, somebody with a personality
Yeah,
that kind of drags you or draws you towards it,
yeah,
which sparks curiosity. And I think like as physicians, by nature, we are curious people in general. And I think one what I would think is recognizing that moment early on in your career as a gastroenterologist, probably, I mean, maybe not too early because some people I think are too eager, but relatively early
mm,
kind of allows trainees to plan ahead maybe and target meaningful programs than just drifting into them. But this is
yeah,
something that we will get, I think, more into. It's like
yeah,
my segue into this, my next question here about probably like about aptitude and personality fit. So, as you
mm,
said, like it's not something that everybody does, like endoscopy. Not everybody's like when they're observing, not everybody's like super into it. But in your opinion,
mm,
what personal traits or attitudes do you think matter most for success in this field?
mm. Um, there's definitely lots of attributes to an endoscopist, isn't there? We already kind of mentioned a bit like team working with people. Obviously, it's practical skill. There's the kind of practical element to it, dexterity, and that side of things. But some of these things can be learned along the way. But I think the more fundamental factors that you need to drive you towards to be able to succeed or achieve within your goals in endoscopy is, I think for me, as I said to begin with, that having a passion, I think is the first thing. If you don't enjoy uh, being in or spending hours being an endoscopy as case doing ESD, then it's not for you. You've really got to have that inner kind of this is the thing I love doing. Um, I think like from that respect, like if some people you're having a bad day, going into work is maybe not your favorite thing. I kind of had it when I was on my first fellowship, doing my research fellowship. A lot of aspects of that was there was a certain amount of service doing endoscopy. And if I was having a bad day and I went into work and did endoscopy, it made my day better. And I think for me that was a sign. This is the place I enjoy being.
Yeah.
I think that you need to have that because there's good times and bad times along the way. And if you're
Mm.
not really enjoying it, then it's going to be a long road. Um, and I guess the other kind of so passion is one thing I think is really important. The other thing you really got to have a commitment uh, to something. You said before about people maybe starting off too early and being too thoroughly committed, and maybe I certainly wasn't that. I knew I had a passion, but it built along the time. I didn't immediately think I'm going to be an ESDist. I gradually built along the way
Mm.
my experience, but I'd stayed committed to what I wanted to do. So, and because it doesn't always work the way you want, and sometimes there's setbacks along the way. But if you stay committed, I think there's usually opportunities that will come your way,
Mm.
and you just got to be open to those. I think is important.
Yeah, yeah. Um, so I've heard people like discuss this with many colleagues, senior and junior, and many of them many say different things. Some people I've noticed from like even I used to think that at some point it's maybe there's a talent that you need to have and like some hand-eye coordination and things like that.
Yeah.
Maybe there is a little bit of truth to that, but then when
Mm,
I started like observing people that I've learned so much from, uh, I think the thing that those best therapeutic endoscopists, let's say, regardless whether they do, you know, ESDs and poems and like EIDs or like hepatobiliary stuff, or some of the like best screeners, like colon cancer screeners, which is not an easy job either, right? Um, they what they have in common is they're usually patient, they're usually humble, they're usually resilient. They always like, they stay on it. As you said, the passion is there. And one thing that I've seen is that they're able to stay calm during like, stressful times, and when they get complications, they learn from what they've done, from their own feedback, and they maintain that
Mm,
teamwork aspect in high stress moments. Exactly
mm,
like you said. This is the thing that I've seen in common in the ones
yeah,
that are really good at that are really talented at what they do, and who are able to teach others how it's done. That's
yeah, yeah.
yeah. Would you say that's
I,
fair?
I I agree with that. I mean, in the end of the day, like so everyone's got different aptitudes, and some people will be better naturally with hand-eye coordination, which gives you maybe a little bit of a head start. But I don't know. I don't care how good you are. When you start doing ESD, we all start a bit rubbish. The experts doing it at conferences, and it's like it looks impressive, but you kind of think, oh, it's not that,
Yeah.
that difficult. As soon as you start doing it, that first time you get a knife and you're doing animal training, you're like, this is a completely different endoscopy. It's such more the fine like tip control, and it's just a different kettle of fish. And you may be better than someone else at the start, but if you're not committed to developing and like humble, um, trying to learn all the time and try and develop yourself, then
Yeah.
you're not gonna get there. It takes a lot of time and commitment to build up that experience
Mm.
to get where it is, because ESD is a long road. It's like I mean endoscopy, it can be challenging, and colonoscopy more so, and EMR and different therapeutic techniques, they all take time to learn, but ESD is much longer than that. So you've really got to be happy to develop that, and as I say, start at the bottom and build yourself up
Mm.
to that development. And I say, yeah, I completely agree. I think the whole the mentors I've worked with who really kind of inspired me. Often they're fantastic at what they do. They're brilliant, but they are so down to earth and they're so humble. And I think that is so important, because you've never finished when you're training in endoscopy, and especially these like therapeutic techniques. You've got to always be learning. Things are always changing, but there's always more to learn anyway. I think every case you can learn from, can't you? So, and that's probably what sets them apart to some extent, is that they're not resting on the laurels. They're always trying to improve and develop.
Very, yeah, true, true. And this is like really a good way to get into the next question that I had for you is about finding mentorship and choosing a center. So how did you identify and secure the right mentor and training center? And what would you advise for anybody who's listening, anybody who's contemplating to apply for something like that? How would you advise
Mm.
for applicants evaluating programs?
Interesting. So I've kind of been through it twice. So the first time, I would say, when I do my research fellowship, which I think maybe there's more research fellowships around but at the moment in ESD, excuse me, I don't know about the rest of the world. I mainly concentrate on the UK. There's not a lot of opportunities to have well structured ESD training. There's minimal opportunities, and this may change with time. As there's more and more experts, but at the moment it's limited. So I had to be a bit more directed with that. But my first fellowship, when I did research, there was perhaps more opportunities around, but I kind of more an opportunity arose. I would say, like I wasn't specifically looking for it, but I would say I was at a stage in my gastro training where time was moving through the years, and I could see consultancy coming up, and I thought, I'm not sure if I'm really certain where I want to be. I enjoy endoscopy. Maybe at that time I didn't see myself as a therapeutic endoscopist, but I thought, well, endoscopy is the thing I enjoy, and an opportunity came by in the nearby city, where there was a research fellowship going, which incorporated a lot of endoscopy, doing endoscopy, but also training in EMR. And I thought that seemed like a good fit. Take a bit of time out, no point in rushing for all this training. And it was more serendipity, I would say, that first fellowship. But it worked out really well. I had fantastic mentors that I worked with. Motorfeek was one of my primary mentor there, really enthusiastic, supportive guy. And another team, the whole team in Sheffield were really great. So I learned a lot there. And I'd say building up my research experience, getting a degree in an MD kind of helped to set me apart for down the line. So when I finished my training and then I was going for an ESD fellowship, that was really helpful. I think having those numbers, so I had like over 1,000 colons, 1,000 gases, a lot of EMR experience from that time. That kind of helped, but also having undertaken research and having published and having a research degree, that really helped to open those doors or make it to make me more of a better applicant for these more competitive fellowships. So in terms of the ESD, so I basically, the way I approached it, I was a bit more towards the end of my training. I realized I saw myself as a therapeutic endoscopist, and ESD was the way of the future in terms of that. I thought EMR would be useful, but there was the way things were looking. This was going to be the skill that a therapeutic endoscopist of the future would likely need. So that I probably about 2 years before I finished my training, I started looking at the options. Right. So, and in terms of initially, I think that's the first step in terms of what are the options available. Here in the UK, there's jobs, you can look on the NHS jobs. So there's every kind of January to March, April, those jobs come available, the fellowships. So that's one way. But I think really a better approach is to kind of get to know these experts ahead of time, rather than just applying. I think if you've already in touch with someone, they already know who you are.
Yeah.
It again helps to set you apart as a fellow, and that I think if you're planning this, if you can, at least a couple of years ahead, start getting the wheels in motion. That would be the most likely way to be successful. I would say. So try and looking that more, ahead of time to get things planned.
Right. I fully agree with you. Like you need to, so you need, like, you always, just like with everything else in life, you need to set yourself apart from like the herd, let's say. You need to like be excellent and at least give that impression that you are excellent and would like to be excellent in what you want to do, and approach either a center or a mentor that you have researched a little bit. It's always better, as you said, like, look into this ahead of time rather than just jumping into something.
Yeah,
Especially if you don't have it available within. Some people are lucky enough that they have it within their own center, and they have the mentor
yeah,
they're like sitting next to them on the morning meeting, so it becomes much easier. But for most people, I think this is not a
yeah,
readily available thing. You have to really want it
yeah,
and go for it. And what I would
yeah.
think, I mean, this quality of mentorship, I think it defines how your learning journey is going to be. I would probably say that it's probably better to train in some sort of a medium volume but well supervised center than in a famous one where you don't get scope time.
Yes. So yeah, I completely agree, Sammy, with what you're saying. I think more than anything else in medicine, ESD training, we're having a one-on-one mentor, mentee, apprentice, master kind of relationship, whatever you want to call it, is so important because as we touched on before, it takes a lot of time, it takes a lot of development, and you have to learn how each other work. You learn how your trainer teaches, but he or she has to learn how you learn as well. And more than that, I think it's I don't envy I don't envy sometimes mentors, because you're putting a lot of trust in someone, and there's it's high stakes. There's potential for complications, potential for adverse outcomes. So they have to trust you a lot, and to be able to invest that trust in you, they've got to have time with you, because how can they know what level you're at unless they've done that, and that takes a lot of time. As I said, I worked with my mentor for 2 years, so he knew me very well, and he'd seen my development during that time. So he, the amount of what he felt I could deal with and the challenges I could face, increased as time went by. And you can only really get that if you've got the same person training you. For me, it seems the most logical and most successful way to approach it.
Yeah. I think the best mentors, they actually teach you to think, not just to cut. That's what I would say. And
Yeah,
when learning is strategy, and learning, like, uh
yeah,
really, like, I mean, how you should do it, like what rather than, like, just having the perfect tip control, because that, I think, you can gain with practice over time. But the strategy, I think that
yeah.
aspect is something that.
Well, I completely agree. And even taking a step back, it's before the patient comes in the room. Is should the patient be coming in the room? Is this the technique this patient needs? Like a plan, and like the way the fellowship I worked in is, we went from the beginning, like the assessing the lesions, discussing the lesions in polyp meeting, to then the patient coming to clinic to discuss, then to the procedure of the ESD, the whole kind of journey,
Mhm.
to kind of consider, because it's a lot of the time it's a potential risk, and you got to think about the pros and cons as well as for the patient, rather than just the practicalities. But yeah, my mentor Noor is he's always talks about, you can't just have plan A and B. You need like plan up to Z. You need lots of considerations. And I think when you're starting, you're just cutting. They're worrying about a lot of the plans, but as time goes by, you've got to start. You start thinking of the plans yourself. Like, what am I doing? This isn't working. I'm not getting
Yeah.
anywhere. What next? And that develops.
Exactly. Plan A and B is not enough. So it's
Mm,
definitely, that's something that I fully agree with. And in terms, like,
mm,
so let's say now, if you back it up a little bit, and, like, before we start, like, this kind of journey, let's
mm.
talk about, like, simulation and early skill building. So, I mean, before
Yeah,
hands-on
yeah,
work on patient, how much valued have you done a lot of simulation work, and how much value do you think that
yeah. Oh,
brought
yeah, yeah.
you,
Absolutely.
and how can
Yeah,
fellows prepare when lab access is limited? Because most time it's limited.
yeah. Tricky. I mean, the experience I had, I guess it varies from what you have available locally. In the UK, I think we're lucky. There is a lot of training opportunities at things like conferences. There's a lot of events through the year, and my initial training was animal model training at these conferences. So you go to a conference, you get an opportunity to for a lesion to resect TSD, and it's just initially it was just getting to as many of those as possible, and then some of them, like I went to one in Kings where you did 2 days and you were just cutting for 2 days, and that at the end of that you were, and obviously working with experts like Amin Haji and the team there,
Yeah.
you learn a lot in that time. That you see a big jump in just that investment of time there.
Mm.
I, I think even then after, so I took got on as many courses as I could, and then again in our trust that I worked in, they had a medical skills lab. We could get hold of animal models, and there was, although we didn't have an expert ESD, there was someone else who was training in ESD in the trust. So we would go together, and he was more advanced than me, and he would be teaching me the bits and bobs, and it just gives you time with a knife. And I think, I mean, the ESG, there's a released kind of publication by the ESG about the training curriculum, and I think it's really important to look at that
Yeah.
and really try and guide your training when you're, if you're considering being an ESD, going down that road, following that. Because if you jump in when you're not ready, well, one, I think most mentors won't take you, but two, just you're putting yourself and the patient at risk.
Yeah.
You've got to put the hours in, and it's a lot of hours. You're looking 20, 30 cases. That's, you know,
It's many hours.
20, 30, an hour at least per case, maybe more. It's, you got to put in, and you do notice the difference, but pre and post that, you see the difference already, and that
Yeah.
is absolutely vital. Completely agree. That's the first step to
Mm.
take.
Mm. Yeah, I think this is like a key message for like any colleagues that want to venture into this. And I mean, neither myself or probably you would feel the same way. We're far from like done with like learning. And I think every case still presents its own challenges and sometimes too many
Yeah,
challenges, especially when you are, I mean, right now you're gonna start like doing this solo, right, on your own. Then you're not gonna. Sometimes it feels comfortable to have that mentor behind your back, but
yeah,
when you're all alone, sometimes it feels like you get quite nervous. And so I've been feeling this myself when I do my cases here. I know that I need to think twice before I do something because right now I do not have somebody with me. I can, okay, can I manage this complication? That's how I think about it. And I think one key
yeah,
message
yeah,
for colleagues that want to learn this is that simulation and these ex vivo models, to a certain extent, they definitely do shorten the learning curve and make early mistakes safe because you'd see what they look like. In addition, you're rehearsing scope control, loop management,
yeah,
how to do incision, how to trim. This kind of builds that muscle memory that pays off once with patients.
yeah.
Um, Also, like I mean, if you do not have a lab available, you can really build your own little thing. I mean,
Mm.
we did this in our unit where like we don't have a model. We just like brought a box and a bottle and but
Oh yeah.
we went to the
Oh, there's ways
pharmacy.
around. We didn't even have. We did. Suppose we didn't even have a box. We just got a lot of like surgical gripping scissors. Just attach those, hold it all down, kind of stick what you call it, the tight tape, for I can't remember what you call it, the plastic tighteners that to put on the end on the esophagus just to close all the holes. At the end of the day, you just need, the most important thing is having a pig model and a scope you can use on pigs, and then a knife. And most kind of endoscopy reps are quite keen to support training, I
Yeah,
found.
yeah,
And that side, the expensive bit, the knives,
yeah,
is usually is not the issue. It's kind of having a trainer is probably more. But once you've got once you've been shown the basics and you've done a bit of, been to a few of these courses, you can just put the airtime in yourself.
right.
You can start gaining the control. Yeah, but I agree. It's this is the thing. It's a very different world. It's important, but it's a very different world to the real life and what
Yeah,
happens in real life. And I mean, you're a bit ahead of where I am with my training. I've worked the last couple of years training with a mentor, and you're right. Having him behind me is a big reassurance. Starting in a new trust solo, it is a different kettle of fish, and I mean, it's you. Obviously, the way I approach this, I mean, I saw myself wanting to do ESD or being an interventional endoscopist, and I kind of thought I saw a lot of people trying to train as consultants in the NHS, and it seemed a real struggle, like finding the time, finding the space, finding the mentors to really get traction and develop.
mm,
And I think the problem is if you get in a situation where you're cutting, but you don't have that training behind you, um, and things will go wrong at some point. I think it's a pretty lonely place to be. One, it's obviously it's not great for the patient, and
yeah,
we want to avoid complications. But
yeah,
you've got to think of yourself. I think you're to a certain, you're going to be an endoscopist for your career, and you've got to look after well-being as well. And the way I thought about it, if I'm going to have complications as an interventional endoscopist, and I want to know in my own mind I'm as good as I can be. So I couldn't have done anything better in that situation.
Yeah.
And the way I think, getting this training, dedicated training, high volume, getting a head of steam on the cases, building and building and building, it puts me in a position where I feel most confident and have the most like skill acquisition before cutting on my own. And to me, that just seemed the best way forward in terms of my own kind of career longevity, because burnout is a big thing in medicine, and it's definitely in gastroenterology and endoscopy
Yeah.
as well. So you've got to think about that and look after yourself, I think, as
Absolutely.
well.
Yeah, it's very important because I mean, one of the things that is like two things I would follow up on is I fully agree with you on these points. It's once you get do some of that training, then you need to kind of put in the hours yourself. I remember uh, my mentor, a great great guy, Dr. David Tate, that I still learn a lot from every day. Really, he taught me two things. First thing that he taught me is that just you need to uh, submerge yourself in virtual learning so that you actually see everything and observe, and like just kind of retain
Mm,
that information from virtual learning, which I think right now there's like a plethora of that out there. So there's no
mm,
excuse anymore for people to say like, I can't, I don't have any place to see this. So
mm,
and a lot of it is available like open access. The not everything is behind a firewall where you have to pay. So like submerging oneself in this virtual learning in virtual learning platforms, and additionally put yourself in that, like the what David used to call the black box, which is basically that simulator, whatever the simulator is, regardless of how primitive it is. Instead of like doing 1,000 colons, just to get your your tip control right, you can just go
mm,
into that, like simulator black box, and just work on that all the time, because you're
mm.
gonna get to do that thing 1,000 times much faster using that thing than if you're gonna need to collect 1,000 patients. And
Yeah,
you're probably gonna dare to do much more and see the cause and effect of your actions, while you're much
yeah,
more, I think you become very much you try to avoid risk taking too much when you are working with a patient.
yeah,
Yeah. So I fully agree with you there. So in terms of your training, if you would speak a little bit about your personal experience in your first months as a fellow, what did your initial months feel like, and how did your level of
yeah.
independence increase safely?
Yeah. So my first, so the 2 years I spent I was in Leeds. The first year, so I probably say it wasn't quite what I was expecting. I think again, uh, flexibility is I think something else is if you're like a budding, you're aspiring to be a fellow in endoscopy, you have to be flexible. um, I think I was keen. I wanted to get in and just get cutting straight away. I felt like I put the time in and all the models, and here we go.
Yeah.
So it wasn't quite like that, and there was an element, and in the end of the day, I think you said this before, learning in the virtual environment, but also ESD, there's a lot of observation that you need to put in, I think, before even. I think that is important, seeing how an expert does it. So then you can, um, mimic or kind of learn from what they're doing. So there is a fair amount of, well, I mean, different for different people, but I think there's generally a fair amount of observation that needs to be done. And alongside that, you need to develop techniques and other things. So it's not just the cutting; it's also the assessment. So to begin with, there was a
Mm-hmm.
lot of assessing lesions,
Yeah.
and it was upskilling other ways. I mean, already had a fair amount of EMR experience, but it
Yeah.
was there's always more to learn.
Yeah.
So it was developing that and my upper GI experience. I had a lot of upper GI therapeutics, and the trust I was in Leeds, where I did my fellowship, both upper and lower. intervention. So it was kind of developing that side. So it was bringing up that basic skills up. I think once to begin with, and I think this is often the case for most people, when you do start cutting, it's in the areas that are more kind of the safer areas, if you like. So rectum, gastric to a certain extent, although we don't get a whole lot of cases, gastric cases in the UK. It's much more lower GI, I think, or esophageal. And so to begin with, it's the low risk stuff, but even still, obviously, you say low risk in terms of perforation, but there's still a whole lot of bleeding that can go on in the rectum. So the way we worked it in Leeds is we do half an hour blocks. So we set the timer, you do 30 minutes. Off timer goes off, your boss swaps in, and sometimes if you're in the middle of a thing and you're just trying to finish it might just overrun. But generally, we'd swap between the two of us, which I think is a good thing. I think there's a big part of ESD when you're starting out is there's like a decision fatigue that you get. You're basically constantly making decisions to cut or not to cut or where to cut.
I feel that. Yeah.
And in terms of efficiency, obviously the patient's there and you've got to finish this thing at some point. In terms of efficiency, it's good because the boss can actually get something done. But in terms of from your own point of view, you can take a step back a moment and reflect on what you've done. And if you were struggling somewhere, you can be like, well, where am I struggling? And then the boss does it, and that's okay. So that worked well. People do things differently, but that's how we worked it in Leeds. And basically, how it started was to begin with. When I was starting, I'd do the easy bits. So like the easier access, you kind of anti-gravity sides, these kind of things. Whereas my boss would do the more tricky bits. And then as time went by, he would be happier for me to do more and more and do the more tricky bits, and then we'd swap maybe less as time went by as well. So just develops, and it was kind of slowly picking up as time went as experience developed, I guess.
Yeah, I mean, I saw you towards the end of when I met you, you were in your last few weeks and of your fellowship, and it was I thought it was just wonderful. Seeing like you work and how calm and chill you were, and then I thought it was really it was really phenomenal to see like how like that level of calmness, and just like maybe you're not as calm on the inside, but like I mean the energy that you feel like, okay, if I were a patient,
Yeah.
I would feel really safe because you are really like meticulous, and I think that's a quite the adjective that you hear being repeated a lot when we talk about submucosal and third space work. You need to be
Yeah.
meticulous with everything you do. So,
Yeah.
so
I think that's maybe. I mean, I think what's going on in the inside isn't always portrayed on the outside, but I think a lot of that is a cultural thing. Where I was working in Leeds, the environment in what we worked was, and that comes down to the way my boss Noor Mohammed runs it, but also the nurses he works with. So, like you kind of alluded to before, if you're working with people you don't know or people who aren't as experienced, it's a completely different thing to working with a nurse who has a lot of ESD nursing, like assisting under their belt. And I think probably when you saw me, we were working with there's like a number of nurses who are have done hours and hours, years of experience. Lil is probably one who say so. She usually works with me because she's the most experienced, and obviously I'm not as experienced. So it actually gives you reassurance, and she like supports you, and she can often if you're in a position where it's a bit not there's always that kind of that voice in your head. Always listens to that voice, that alarm bell in your head. She's another alarm bell, so she'd be like, there'll be that kind of sound. So you've got that kind of person next to you who's already
Yeah.
like another checkpoint, if you like.
Right.
So,
Right.
but that was, and I think that kind of, like you said, that I was saying the culture of a place, working in somewhere where it's good humoured, it's calm
Yeah.
from the off. There's not this stress, because at the end of the day, stress will come. There will be
True.
perforations, there will be bleeding.
True.
If you start at a point where there's very minimal stress, when the stress comes, it's easier to manage, I think.
Exactly.
Yeah, I think that is a very important, like, there's non-endoscopy technical skills, like nets is so important, and it's very, you see it and you feel it, but it's hard to kind of really describe it. Like, it's not like you say do it like this. You have to develop it, don't you? You have to
Yeah.
build that and invest time into that culture. So
Exactly.
yeah,
Yeah. And it's a very like I think it's done quite often. It's much more practice I think is surgery because it's been around much longer than what we do. But I think we're getting better and better at it. But exactly you said it's not something that you can just put words on. You just kind of need to feel it and work on it. But I think I mean, this stepwise responsibility that you are talking about, starting with the easy bits and then going to the more difficult ones, that's very critical. Like early on,
yeah,
to learn like how to do this, like patient selection. You need to learn you need to know your scopes. You need to know what you have in the
mm,
room, your tools, that like table, how it's set up,
yeah, yeah,
what is
yeah, yeah.
there, the setup,
Oh
the
yeah, yeah,
like
yeah,
your electrocautery settings. You cannot just like say just switch on the RB, machine. You cannot. You need to know what is there and the post procedure also,
yeah, yeah, yeah,
right? So I think the best kind of like fellowship programs, probably they would let you progress only when consistency and judgment are clear, not just after a certain number of
mm,
cases, because I mean, I think
mm,
in general, like in when you're just learning diagnostic endoscopy, like, they just go after, yeah, you've done like you've done 200 colons, 200 uh, gastroscopies. Okay, you're set, you're okay, you're good to go to scope. But it's a whole
yeah,
different ball game when you're starting to do therapy, I think. And
yeah,
so I think that's very important.
So, my next question is about like technical hurdles and complications. So, in your experience during a fellowship, what was the hardest technical step for you in, let's say, in ESD or poem, and what helped you master it? And also, the second part of my question, can you recall a complication that changed how you work, that basically transformed your
yeah.
practice?
Yeah. Okay. Technical skills. So I think the first, we kind of touched this on a bit. I think the first hurdle really in ESD, I think if you're starting out, is well, there's I guess there's two key things really. Is one is tip control, which is, we've spoken a bit on before, but it really is the difference between, I think, the key difference between EMR and ESD, which you don't get the same amount of practice to do or exposure to when you're doing EMR as you do ESD. Um, and the other thing, yeah, is, I think the other key thing is plane recognition. So your mucosa, submucosa, muscle, and that respect for the muscle, I think,
Yeah,
is just
God,
so important. Which I think in all of us, like a gastroenterologist, I think surgeons, gastroenterologists have kind of got this different, like, maybe like approach to endoscopy. I sometimes feel, because I don't know, just because a perforation for a gastroenterologist feels like the end of the world. Which maybe this isn't fair, or maybe it's biased uh, point of view, but you sense that surgeons, it happens to surgeons, and they kind of deal with it, or it's going to happen. If you're doing therapeutic endoscopy, it's going to happen. I think maybe there's that slightly different, and interventional endoscopy is kind of sits in the middle, if you like, between gastroenterology and surgery. But in terms of, so in terms of the muscle, you've got to be able to recognize your planes. That's absolutely key, because perforation is, you realize when you're doing the pig monitors, is incredibly easy to do if you if you're not concentrating or you don't have the control. And I think inevitably everyone cuts the muscle, and that's the whole point of practicing. So you're learning what not to do. So I think that those two
Yeah.
skills are probably your first things that you really need to master. At the end of the day, I think for me, putting that time in before doing a fellowship was key to kind of have an aspect to that and have that kind of safe.
I fully agree with you that one thing that I really like, which is like it's not just like the barrier is not just your dexterity, it's like, learning, like, this kind of tension control and that visual discipline. You need to be paying attention. You should not drift in your thoughts because they can be so lengthy, these procedures, that I think sometimes you easily can drift in your, like,
Focus. Focus is key. Is if you can get in the zone, if you that is something that would lend you towards, talking about attributes. If you're someone who can get in, I feel like I people who know me well, I probably seem a bit kind of like bang 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 in general, like different things going off, perhaps like in conversation or something. But in endoscopy, I feel like if I can get in the zone, and things like ESD is something that really focuses you, you have to focus, then it's weird. Time can shift. You get in this weird place where you don't know how long. And that's where, saying having these half an hour times is useful. Know how long you're doing something for, and you need this. And I'd say that's something else. Is looking after yourself is and it's something that's becoming much more topical recently. Is the whole kind of ergonomics and and that's something you got to really think about if you're doing a lot of endoscopy, especially ESD. Is looking after yourself in terms of joints and whatnot. And those half an hour pauses, I think, is really important as well, to take a step back and be like, right, stop, down tools, stretch. I have a moment to think, and then back on it again. So, but
very important. I fully agree with you. These ergonomics things, like, you need to think about, because a lot of people that are slightly older than us have been doing this for a while. They're all suffering from some chronic condition just because of that. So I fully agree with you. A lot of people that go into fellowships, and I really, like, when I was like preparing like for this episode, I was really like trying to think like what kind of objective advice we can give to people who would like to kind of go venture into any kind of, like, advanced endoscopy fellowship. And I did a lot of search as well. It's not really that easy because, I mean, every part of the world has totally different like setup and, different kind of training and everything. So it's really difficult to like give a one size fit all solution to that. But what is common, so that, like, in general, if you are about to venture into something like that, most people do it after their training. So they are pretty much fully certified and accredited gastroenterologists, and some of them have been working for some years as gastroenterologists. So they're kind of, on paper, they are consultants, or they're about to become consultants. Uh, and then all of a sudden, you're going to shift again to becoming a fellow. So, and you kind of were almost there, right? You finished the MD, pretty much. You could have gotten a consultant job, right? If you were not to. And so how did you handle this shift from, like, just at least mentally, from like you're about to become a consultant, gets twice as much pay, to becoming a fellow, and balance like this training demands with, like, personal life? Because quite often we need to keep that in mind. We all have things outside work. We have a family, mortgage, everything, that requires paying attention to.
This is true. There is different sacrifices you make, and time and money is generally things is that you will be sacrificing. I guess it depends. It depends what your commitments are and your responsibilities, and what you can manage. I mean, for me, money's probably not my primary driver, I guess. So that kind of helps a bit. And then obviously, and even as a fellow, you still pay. The pay is not bad. You can get by. Like, you can pay your mortgage, you can pay your bills. You can still go on
Mm.
holiday, but obviously it's a bit of a sacrifice. But I guess the satisfaction of doing a job like I really, as I said, enjoy and look forward to doing and getting like a buzz from, for me, that was of more value, I guess, than
Mm.
the money. So although, okay, I've done 2 years of a fellowship, that's a sacrifice. I could have been a consultant 2 years earlier. I'm going to start a job in a month's time. I'm so excited. I can't wait because it's something which is badged as an interventional endoscopist to provide ESD. That's the whole point of the job. And I'm like, that's fantastic. And
Fantastic. Yeah.
through the fellowship is that opens a gateway that wouldn't be there otherwise. I think
Mm.
getting those kind of opportunities, if you try and build that through a consultant pathway. So in the UK, as you said, it's all different places, but you take years and years and years to get there. Like, training you can get as a consultant in the NHS, you can maybe have a week, but then you think about the leave, you think about your leave, you think about your on calls, you think about your trainers on calls, their leave. The amount of actual training you get, it becomes a sliver. Whereas you do a fellowship, and in Leeds we have 3 training lists a week, so that's in a year you just get the opportunity to jump from being someone who has very limited experience to someone who's had the opportunity to really upskill and make
Yeah.
and that transition. You sense that in yourself. Like I'm with you, and in terms of I'm not mad. There's going to be some times that are going to be challenging, but it's exciting, and I feel ready to kind of like learn from those challenges and to kind of
Mm.
develop further. So
Mm.
other than that, monetary definitely, and I mean, there's always at a certain extent there's going to be some potentially demands from a family life, like from where I was. The job itself was actually it was not too demanding. Like there was service commitment, but it was in hours. There wasn't hardly any weekends, no nights. So
Mm.
compared to being a trainee where you're on a rota doing loads of nights and weekends and the whole
Right.
shebang, it was actually that was nicer. So actually, you had a bit more control. You did a lot of work, and being a fellow isn't just the work you do in that clinic or that endoscopy.
Yeah.
As a fellow, I think there's that responsibility of your trainer is training you, and you're learning a great opportunity of doing that. I think
Mm.
there's a payback where there's a lot of extra work you do for your boss. There's the preparing for the conferences, there's doing the videos, there's preparing these cases and those cases, all this extra work between times that kind of fills into the gaps. That kind of
Mm.
fills a bit more of your time, and that at times can obviously spill over into your home life as well.
Yeah.
And then from where I was working. I mean, probably for a lot of people in the world, it's not that bad, but in the UK, it feels like a long commute. So it's like an hour and a half from where I lived to work. So like 3 hours travel every day. You factor it in as well. So yeah. So there's definitely some trade-offs you need to consider as a fellow,
Mm.
and it's whether you're willing to take to pay those prices. I guess for me, it seemed a fair trade, but people in different situations.
Um, yeah, so exactly like you said, Tom, it's really like about sacrifices and really like that perseverance and wanting it. I mean, and then in the end, this will open up many doors for you. But for the vast majority of people, they are in places where maybe a you know uh, therapeutic endoscopy or like submucosal work theory space does not even exist in the country
Mm.
at all, and some people want need to go abroad and do it. And so
Yeah,
what would you say to these fellows? What should they do? Like, they have the passion, they have the perseverance, they don't mind even, paying out of pocket, to support themselves for at least a while. How should they
yeah,
go about it? Because I find most people struggle with that little aspect or
yeah,
big aspect of it.
yeah. Yeah. It's a difficult one. I think it's can be tricky. I imagine. And there's different approaches. I think things like conferences where you've got the opportunity to meet obviously experts is one thing, and speaking to people, introducing yourself, and finding out if there's opportunities. I think people are probably mostly much more receptive than you'd expect. I think it's probably for some maybe a bit, you don't want to be talking to the big cheese. I know I probably put myself in that camp as well. I don't think I would just walk up to one of the experts and say, "Here I am. Can I be your fellow?" It feels a bit too forward to me. But I think opportunities that I think is a potential in is to find out who the current fellows are, and I think that gives you two positives there, because one, you can find out what the job is like. I mean, obviously they may be a little bit biased because they are working there and they are a fellow, but most will probably be candid and will give you a fair assessment of what the fellowship actually is like, because not every fellowship is like created equal, I don't think, and getting a clearer idea is really important. So that's one thing, you get an idea what the fellowship's actually like. But two, it gives you a bit of an in, because if you know the fellow and you've spoken to the fellow can potentially introduce you to the potential mentor. And it's right. I know for both of my fellowships I did, someone introduced me to my potential mentor and got chatting, and it kind of went from there. So I think, I mean, I hate the word like networking, the term, but I think building those relationships with people, working with people, you're not going to get very far on your own. You're going to need support. And I think you'll be surprised. I think there's a lot of people out there who are actually keen to support people and offer assistance if they can. So I think it's an email, reaching out to people, I think is you've got nothing to lose, really.
Right.
So that would probably be
and going to meetings, going to conferences, going to courses, and I think cast a wide net rather than just sticking to your a small geographical area. You have to be willing to relocate. You have to be you have to know your situation beforehand, that you're able to kind of move your life around or adjust your life for those couple of years, or a year's time, or whatever it is you are willing to put into it, and then take it from there. But really casting a wide net. Exactly. I don't like the word networking either, because it feels like you're just sucking up to people, and but
it kind of feels like you're just trying to take advantage. I hate the term, but I think building relationships with people, the more people you work with, more collaboration you have, good things come from that. I think that is, you can't lose that way. I completely agree. I think that I kind of said before, those kind of aspects to what will make a fellow succeed. And I mean, when I started out, didn't have hundreds of publications. I wasn't like the best trainee ever, but the things I had was I had a passion, I was committed, and as you said, flexibility. If you've got the flexibility to move or to spend time to commit to develop the fellowship, then that is really important. If you don't, then it's tricky. I think, as you said, if you haven't got flexibility for whatever reason in your life circumstances, it limits your options. And really, you're right. The wider your net is, the more you can move or for a fellowship. If you're committed and you can willing to dedicate some time to it, you will find opportunities, I think. So
for sure. Yeah. And life happens, right? Sometimes, I mean, it's very important to be also pragmatic. Sometimes just life just happens and just throws you off your course. But I mean, if you have the intention and you take this as a long-term learning journey, even if you started off and you have to pause it, or change the way you're learning, at least you've put yourself on the right track. And really, you have managed to forge that relationship with someone that you can call a mentor, that you can rely on, even when you need help, or when you need let's say advice how to proceed, or if you need pursue maybe you start somewhere and then you need to finish it somewhere else. At least that mentor can put in a good word for you with somebody that is closer to your location so that you can
Yeah,
actually go there and continue. So it's exactly the way you said. It's and in terms of like, there's so many ways to get support out there nowadays.
yeah.
In order to actually learn and go abroad and do things, especially if you're like under 40 years of age, which is where that's when most people actually start doing that stuff. So
Mm-hmm.
so I think I fully agree with you, having that dedication and wanting to do it, and then try to like create rapport with the person. If you do not have rapport with the mentor from the beginning, it's maybe it will be difficult to develop it later on. You need to feel it. You have to feel that chemistry, right? I mean, with that person,
Yeah,
you're
yeah,
gonna
yeah,
spend so much time with them in the room under like high stakes, tension,
yeah,
and
yeah.
you need to like feel comfortable where you need to be able to be vulnerable around that
Mm-hmm.
person, and as you said in the beginning, which I thought was great. Like, I mean, that mentor is really taking big chances when they're giving you the
Mm-hmm.
scope. I mean, because if you do something wrong, they're gonna have to deal with it. They have to be
Yeah,
confident and comfortable enough to actually trust you enough to want to
yeah,
train you. So it's I
yeah.
fully agree with you. So wonderfully said, Tom. Um,
Thanks,
let's see here. If we now like say we have managed to overcome these hurdles, found the fellowship, you did it, and and got out in one piece, the other end of the
Mm-hmm.
tunnel. Um, how after finishing, how do you how would you plan to integrate new skills back into your home institution, and what challenges do you think you'll be facing? I just been through this recently, so
Yeah,
I'd shift that question to you and I say, what would you think is maybe your biggest?
yeah. One of the things that is always a bit of a challenge, I guess, for any ESDist. To begin with, you want to be working in the rectum. To kind of, as what he said, is generally a bit of a safer area to start work. And I think fitting in with your surgical colleagues who may already be taking a lot of the rectal cases, I think that would be a something to see how it goes. I guess that will be. And at the end of the day, I think the way I think of it is, if you're working with people, you're more likely to get to a outcome that you're both happy with. If you're working kind of against people, then it's going to cause someone's going to be upset. So I'm going with a collaborative approach, I would say, and in my mind's eye, I think ESD it's kind of a bit of a paradigm shift. I think, especially in a lot of the work that used to be surgical, ESD I think offers a better opportunities, especially like you're talking like things like EID and things. There's
Mm,
there is I don't know, like sky's the limit. There is things will be progressing, and there'll be more work that we can do endoscopically um, that may previously have been more of a surgical domain. But
mm,
I think you've got to prove that. You've got to demonstrate that to your surgical colleagues. You've got to show what you
right,
can do, really. And I think I hope my plan is let the kind of work do the talking
right,
and show the results. I think
right.
that's speaking to people who've been through this challenge already. That's the way they kind of went at it. It makes sense to me. So
Yeah, fully agree.
we'll see how it goes. But yeah, that's my current strategy. Um,
Mm,
yes, I think that's probably the main. I think there's. I mean, Gideon, it's starting a. Although I say there's been work there before, you're still starting mainly from a standing start. So it's finding the cases, it's building that
right,
network in that area
right.
of the country. In the UK, there's not a lot of submucosal endoscopy, so there's captive audience, if you like, potentially, but it's building that footprint,
Right.
I guess, to say this is what we're doing here, and developing that service, I think. So
Right.
yeah,
Yeah,
it's exciting, but I'm sure there'll be a lot of challenges to
for
overcome.
sure. I fully agree with you. But it's a fantastic, like collaborative approach, being slightly patient in the beginning. And of course, if you don't have this set up from the beginning, I guess ensuring that you're going to a place where the environment is supportive so that what you've
Yeah,
learned actually can be utilized. And then,
yeah,
securing the right equipment, training the nurses, convincing
mm,
your administrators, it's like you want like true success is like transferring what you learned safely to your own setting, right? I think that's what
yeah.
comes down to in the end. Yeah. Um, and there's one thing that you touched upon like earlier in the title, like so what outputs proved most valuable for credentialing and your next job? Like was it worth it?
Uh, I personally, I think, well, I've not, I have to say, I've not even started the job yet. So I guess the proof will be in the pudding. But the sense is, I mean, this where I'm going to work is a place where it's keen to support an ESD service. It's to provide that service to that population. Uh, and if all goes to plan, then for me, definitely worth it, because
Mm.
it's, as I said, it's the job that I get a lot of satisfaction from, and it's something I can feel like I can be
Mm.
happy doing for the years to come going forward. And
Mm.
obviously, this, at the end of the day, we don't know what the future holds. Things will likely to change. We're not going to be stuck in ESD, but things will probably progress and there'll be new things. But it's about being currently on, that cresting that wave, if you like, where you can be at the forefront of developments rather than lagging behind, because it's quite hard to catch up, I think, once that occurs. So
Mm.
so from that respect, yeah, I from a day-to-day working balance and what I'll be doing, I think it's been definitely worth it. Obviously it's invested a lot of time, but it'll pay back, I think, from that regard. In terms of, I mean, it probably differ in different areas. In the UK, you basically, whatever your job you're doing, if you're the best endoscopist in the country versus your job in gastroenterologist in a small hospital, your pay is the same. So financially, maybe not, but I mean, there's different ways to earn money, I guess, if people are looking for like other revenue streams, like
Yeah. Yeah.
collaboration with industry or private work and things like this. So
Yeah.
perhaps you can tap in more to that respect when you're, as I say, more. If you are at the forefront of the field, then that will help from that regard. But I think for
Mm.
me personally, it's about having a job. I'm going to spend you spend a lot of your life working, don't you? So
Yeah.
if you can do that happily and getting a lot of satisfaction, to me that seems worth it. So
Absolutely.
yeah.
Much more worth it than just pursuing. Yeah, I think that's totally fair. I fully agree with that. Um, Practical advice for future fellows. If we were to give
Mm.
like let's say if we were to give three concrete steps for like any aspiring fellows that they can take from this to move closer to a structured, like evolving program or fellowship,
Mm.
what would be the three
Okay.
concrete steps that you tell them do one, two, three, and your chances will
Yeah.
increase exponentially
Yeah.
to
Yeah. I think so. I think first step, I think, is you've just got to take the opportunities that you have available to you. So wherever you are, there will be opportunities to develop endoscopically. So ESD is a long way down the road. And obviously, you've got to start off with your diagnosis. You're going to start doing your therapeutic. This is, a lot of time that you'll need to develop before you'll get even to considering doing a fellowship in ESD. Where I was, like when I was training, my priority after, responsibilities on the ward or the clinic or blah blah blah, I would go to the endoscopy. So actually, so sometimes that was the first thing I do. So I go to the endoscopy suite before I go to the ward and say, if there's any bleeds today, here's my bleep number. Let me know. I'll come down and
Yep.
join. And it's that kind of things, those kind of interventional experience. You can't just click your fingers and it happens. You have to put the time in and make yourself available to do that. And uh, again, developing relationships really helps. If you get on with the nurses in the endoscopy department, they like you, they're much more likely to bleep you. One of my tactics was I'd go in, it wouldn't just say, oh, can you bleep me? I'd go in, I'd bring like a box of chocolates or a packet of biscuits, give it to the nurses. You know, you're in the good books already.
Right.
And I
Right.
think that's the first thing. Just take whatever opportunities you can for intervention. Wherever you work, there will be someone doing some kind of interventional work. And
Yeah.
maybe you don't get hands-on to begin with, but even just seeing, you know, the EMRs, seeing the big EMRs, what their approach is, because there's always stuff to learn from all the way along the way. So I think
Absolutely.
making yourself available, taking the opportunities that are there, I think that would be the first thing, because all that helps. I probably didn't do this as reliably as I could, but the more you log as well, whatever you see, log it. When it comes to applying for things, if you've got all the numbers you've done, all the cases you've seen, all the cases you've done, obviously hands-on, all that helps. So logging from the off, I would say for all therapies, go hand in hand with taking the opportunities.
Yeah.
Two, I'd say, so these generally these things are competitive. So whatever you can to get yourself ahead, I think you should do. And there's different ways you can do that. Experience is one thing, like the number of cases you got, but then often research side will be helpful.
Yeah.
Research isn't necessarily for everyone, but I think if you want to get one of these jobs, you've got to cut yourself apart from the crowd, and that
Right.
is one way. If you've got stuff published, at least you've got a degree in some kind of research area, then that is something that will set you apart. It's a more commitment you've got to put in, but I think that will help in the end if you can get that. And I guess we've already kind of said the other thing is keeping your eyes open, planning ahead. When you go into these conferences, when you're meeting people, kind of building, instead of waiting to the end of your training and think, oh, I'm looking for a fellowship now. If you're starting thinking about this 2 years ahead, 3 years ahead, that's the kind of time you want to be finding out where these fellowships are, having your ear to the ground, what's available in your area, and getting in touch with people early, because that will make the difference as well. So I think those are probably the 3 things. I didn't do in necessarily a structured way, but the 3 things that made the difference for me in terms of being able to get on the fellowship I wanted to do. So that would probably be the way I'd direct people.
I fully, I mean, because I was like, when I was like getting ready a little bit for this, I was thinking about this as well, and I pretty much reached the same like kind of conclusion. You know, it's like you need to define your goals early, know what you want to do. You know, maybe not too early, but at some point you need to know. You need to decide, I want to do this or that, uh, and then you need to build your, you know, this kind of log, procedural log. You know, you need to log everything you do and reach out to mentors. You know, and the opportunities that will come. I mean, if you show genuine preparation and consistency, you will get the chance to try things. It may take longer than for some other people that have it, you know, that have better connections or contacts or will have it readily available. But you know, with consistency and really and that passion, you will get there. And it's, as you said, it's not something that is. I don't think it's not only just for the UK. Many parts of the world, this is something that is done mostly in like, you know, government run hospitals and like, you know, institutions and academic institutions. So you're not really going to get paid more just because you do that. I mean, so your reward must be something else than the monetary one, which is basically providing cutting edge kind of care for the patients and actually giving them a solution to a problem that is dire and that may require much more radical solution compared to like just doing what we would do and then have the patient go home same day or 2 days later, right? So
Oh yeah, massively.
yeah, great. I mean, thank you, Tom, for sharing like such a grounded perspective. I really enjoyed this and lovely talking to you. I mean, I felt that way when I first met you in Leeds, and I'm very happy that I've taken the time. I think like this talk today, like just chatting with you, I sometimes like write down some things that some bullet points of the things that the let's say the pearls of the chat. One thing that she says like the skill is built in layers, doesn't come all at once. So like you get that exposure, mentorship,
Yeah.
reflection, and then like passion and perseverance. So I think fellowship is not about it's not about like where you're going, but like I guess most likely who you become along the way, because you really, I mean, personality shifts. You start a certain person, and when you come out on the other end, you're doing it the right way. You become a whole different person. I think a much better one, hopefully.
Mm-hmm. Mm.
Then
Yeah.
that's how I feel about it. Yeah.
No, no,
Wonderful.
yeah, I agree with
Mm.
you.
Any final words, Thomas?
Well, no, it's funny, isn't it? I kind of had a thought about what we were talking about before uh, before we even when you mentioned this before in Leeds. But it's funny, isn't it? When we start getting chatting, it's a lot of this stuff just kind of untaps. It's interesting to kind of reflect on this and the journey along the way. I've really enjoyed it. I really appreciate you sharing the time, Simon, and inviting me to take part in it. As I say, I hope some of it's useful to some of your listeners or watchers.
Thank you very much. Yeah, hopefully, like anybody who's into this would learn, hopefully, I think or two from this. So I wish you all the best in your upcoming journey, and I'm sure you're gonna do great. And hopefully, I'll come and visit you in Southwest, and maybe we can
Yeah,
do a couple of procedures together. It would be fun.
yeah, yeah. I'm looking forward to coming to Oman as well.
You should definitely. It's a beautiful place. Thank you
Yeah,
so
yeah.
much. Thank you so much,
All the
Tom.
best. Cheers.
Thank you. All the
Thanks a
best.
lot.
Have a good evening. Thank you. Bye bye.
Bye
Bye.
now.